Scientists across America are being told to do more with less while also having more red tape and more surveillance and scrutiny around the topics that we study. I think that this is a recipe for disaster, and we're not going to have much innovation and be pushing away a ton of young scientists like myself. But I am open to hearing thoughts on how this is not the case. I wanted to go over some of the numbers from this really great essay in the New York Times by a medical researcher. They use some data from an aggregate database called GrantWatch, which has a bunch of the different terminated NIH, NSF, and other federal awards that have been ongoing over the past 4 months. And then I'm going to also kind of overview some of the downstream effects it's going to have on early career scientists as well, and then the future of science, because that's what early career scientists are. The NIH is the largest funder of medical training program and medical research across the globe. And so $578 million of the recent grant terminations were for training programs specifically. And so these are programs that are meant to train PhD students, master students, some physician scientists, so MD, PhD students. And these are the people who are going to hopefully bring forward new innovations and new discoveries in the future of science. It's one thing to set institutional priorities for future research because that is what you believe in and that's where you think that the mandate of voters wants you to promote. But it's a whole other thing to terminate ongoing awards because that dramatically impacts people's current career trajectories. And also, we're seeing it's going to really impact the training and future promotion of young scientists. For me personally, this is incredibly alarming because these are the people who are supposed to be my colleagues in the future or potentially some of the programs that are supposed to support my work in the future. I'm concerned about how discrimination in healthcare impacts care for heart disease for middle-aged and older adults. And I think that's a really important topic. And this is something that is considered woke science or diversity science now when it's something that anyone can experience. And so I think that there's not a lot of thought that's going into these terminations. And there's also not a lot of thought in terms of the topics that are being targeted. But there's also the proposed funding cuts for the NIH, which are through the big, beautiful bill, which is what is the upcoming prospects of science and scientific funding. And so there's a lot of rhetoric about the current administration's agenda to hopefully make America healthier again. I am a big skeptic of that. But again, I think that we do have a lot of health issues in the United States that we need to tackle. And so these programs and the different institutes that are supposed to be at the forefront of solving some of our biggest health issues are receiving some of the largest cuts in funding. So you're ranging anywhere from 35 to 40% for the future awards. And so my question is, if we're going to stop training and we're also going to stop funding the future of science in some of these really problematic areas, what's the solution? How are we going to have healthier people?